Many children's doctors say that they are floored. New government numbers show more than 11% of school-age children are diagnosed with ADHD, and that's a jump of more than 50% in just the past 10 years. Our Brandon Lewis is live in the newsroom tonight, and Brandon, this disorder affects millions of children and, of course, their families, too.
It does, Dorian. The numbers show boys are getting diagnosed even more. 1 in 5 high school boys now has ADHD. Many are given prescription medication like Ritalin or Adderall, but some doctors caution against it and even fear some are being misdiagnosed. Children are having a tougher time focusing in school and at home. New data from the CDC shows that leads to the highest ADHD diagnosis rate since surveying began in the late 90s, a surprising statistic for a disorder once considered underdiagnosed by mental health professionals.
ADHD in particular is a diagnosis that really requires a very thorough assessment of the youngster, input from the family, and very often from teachers. There's an enormous shortage of child psychiatrists in this country, so much of the care of these youngsters falls to pediatricians.
ADHD is hard to diagnose because there's no specific test. Combined with pediatric visits averaging only 8 minutes, and it's easy for some to mistake another disorder for ADHD.
There are many reasons this is happening, I think. Primary care docs, there's few of us, there's more patients, there's less time, there's less money, and we are expected to counsel and diagnose and treat a condition that often in the old days was diagnosed by psychiatrists or psychologists.
Saperstone often consults with others before diagnosing, but not every doctor has time. Even when mental health workers are brought in, it's up to family and teachers to give assessment on a child's ability to focus in various situations.
Youngsters are struggling today. There are more youngsters in special education today than before. There are more youngsters, as we know, being diagnosed with ADHD. Accurately or inaccurately given that diagnosis, there's still youngsters that need some help, and that's what we ought to be talking about.
Doctors say the awareness ADHD has received may be contributing to an increase in cases. The American Psychiatric Association is expected to release new diagnosis criteria on ADHD in May, which could help give better guidelines for doctors to use. In the newsroom, Brandon Lewis, CBS 6 News.